my name is Anna, and I am now officially a registered nurse, which I am so excited about. Because this whole process is still really fresh in my mind, I thought that I would shoot my first ever YouTube video and talk about the NCLEX, which is the board exam nurses take before they can practice as a registered nurse. I'm going to talk about the tips and tricks that worked for me on exam day, as well as what I used to prepare for the exam. I casually throughout nursing school had downloaded an app called NCLEX Mastery, and it has about 2,000 questions. I was using that on days when I was working in the hospital and it was really slow. I would just casually flip through a couple of questions, but my school didn't use any of the stereotypical NCLEX prep materials that a lot of other schools use. I never took the HESIs or the ATI or had a specific class to prep for the NCLEX, but what our school did offer was a free assessment. And if your school offers a free assessment, I would absolutely recommend you taking that. Our school offered a free Kaplan test. It was 150 questions, and it was going to gauge your NCLEX preparedness, how ready you were to take it at the time of graduation. So I took the exam about a week before I graduated, and it put me at a pretty high chance of passing just based off of the precursory assessment that Kaplan offered. And I hadn't really seriously delved into studying yet, but it did bring up a lot of areas of weakness for me that I knew that I needed to focus on when I really dove into studying over the next couple of weeks, and that was really, really helpful. After the free Kaplan exam, what I used exclusively to study was UWORLD. I really can't recommend UWORLD enough. It was a really great program. The thing about UWORLD that's different from all the other prep materials out there is that the format of UWORLD looks exactly like the NCLEX, and that's really going to help you with exam day nerves, or it did for me at least, because the study materials that I had been using every day, all day, looked exactly like the licensure exam, which was really awesome. So UWORLD has about 2,000 questions, and it's all broken down into a lot of different categories. You can create an exam for yourself up to 75 questions at a time, and you can select from a drop-down menu all of the different subjects that you want to study. And for me, after I got my authorization to test, or ticket to test, I studied for the NCLEX really hard, only 12 days. And I also really recommend for people out there, just trust your gut. When your gut says that you're ready to take it, and when you've taken a lot of prep work and you've taken a lot of different assessments, and if the data says that you're good to go, you're never going to feel ready. Like, you're never going to feel like you know everything or that you're good at every single subject. But if you have some data that says you're ready to go, then, and if you're like me and you're freaking out and you need for it to be over with, I would say just go for it. Over the course of the 12 days that I studied pretty intensely. I studied a lot. I did about 3 rounds of 75 questions each in a day. So I did like 225 questions a day for those 12 days. A lot of people recommend getting all the way through UWORLD, and I did not finish all of the questions in UWORLD, but I felt that I was ready after 12 days. I bought the UWORLD package. There's different packages, and it's basically a subscription for how long you want access to the QBank and how many assessments you want. I bought the version that has 1 assessment and access to the QBank for the shortest amount of time. That was either 30 days or 60 days, so I bought the cheapest option. The night that I got my authorization to test, I came home immediately and I took that assessment. I placed at a place where it said that I was highly likely to pass, and it's based off of percentiles, so I think I was in the 80th percentile going into it, and of those who were taking the test, so not 80% correct on the questions. And then right after I finished the assessment, I scheduled my exam for 4 days from then, because I knew I just needed to go ahead and get it over with. As far as prepping, I would say get through as many of the questions as you can and really read the rationales about everything that you get wrong. And there's also a feature on there called flashcards where you can just highlight and select something that you don't know and throw it into your flashcards. So I used that for all of the things that I was getting wrong, as well as all of the like anatomy things. So anatomical positions for where to listen at the different heart valves, cranial nerves, how to use crutches. They have pictures and diagrams, so I put all of those in my flashcards. So every morning I would wake up, I would go through my flashcards of everything that I had gotten wrong. I would go at 5 a.m. and I would take a 75 question exam, and then I would go to work for my 8 hours. After I got off work, I would come back and I would do 2 75 question exams. So I did that during my 12 days of really intense prep. And after I had received my authorization to test, I scheduled the exam for 4 days later. And this leads me now to a place where I want to talk about you are not going to be getting 100% on UWorld, and that's totally okay. Passing for the NCLEX just means that you are to a certain degree of certainty statistically above the 50% mark. And for me, I never averaged across the whole thing for UWorld, all of the questions put together. My average was 60.2% answering correctly. And that was enough to put me in somewhere in the 70 or 80% of those who were taking all of the questions at the time. And that just means that you're getting 60% of the questions right, which is awesome. And that is going to freak a lot of nursing students who are perfectionists out, because we're used to getting higher grades than 60%, right? But the NCLEX is just totally different. And now I'm going to phase into test day tips that really worked for me. Even if you only get 75 questions, which I was lucky to only get 75 questions, prepare yourself mentally to be there for the whole time, the whole 265. Everyone should eat before and bring snacks and water. So I left at 35 questions to go eat a protein bar and a banana and to go to the bathroom, because I needed to take a little bit of a break and I needed just a little extra kick of a little bit of sugar in my system to power through, because you're so focused when you're taking the exam. It's really mentally draining. So everyone needs to have snacks. Know yourself, know you if you are a morning person or an afternoon person. So I did way better doing it at 8 a.m. so that I could be done really quickly. Some people are not morning people, so know that about yourself as well. Pick a day when you're not going to be freaking out for a long period of time. I would say pick like a Monday or a Tuesday if you can. A Friday I think would be kind of hard to take the exam. And also, this was a huge tip that worked really well for me, is keep a tally mark on your sheet of paper how many hard rated questions you get. So everything that is a select all that apply, order and then the correct order, or a click the hot box or click in the right area to select what they're talking about, those are all hard rated questions. If you are getting a lot of hard rated questions and you only have 75 questions or 130 or however many, if you are getting between like 25 and 40% hard rated questions, you probably passed. And that doesn't mean that you did pass. You could have gotten all of them wrong, but you can get a higher percentage of the hard rated questions wrong. And if the NCLEX keeps spitting hard rated questions out to you, that means that you're doing really well. The NCLEX makes everyone feel like they failed. Like I walked out feeling not super confident, and I cried a little bit when it shut off, just like a single tear, because nothing prepares you for that, and your stomach drops and you're really freaked out. But I kept a tally mark of everything that was a hard rated question, and on my 75 questions I got 26 select all that apply and then 9 of the other hard rated questions. So it was about 50% of my exam was rated as difficult questions, and that kind of gave me a little bit of peace of mind falling asleep the first night. And as far as the rest of just waiting to hear for your results, I would recommend paying for the early results 48 hours later. I did not do the Pearson VUE trick. If you don't know what the Pearson VUE trick is, you can look it up. There's lots of videos about it. Essentially, if you passed, then hypothetically, you can try to pay for the exam again and it won't take your credit card, but if you failed, it'll charge you $200. So I didn't feel like failing and losing $200, so I didn't do it, but other people out there have done it and say that it's great and all of this different stuff. So those are a lot of the tips that I have. Yeah, just make sure that you have some snacks and make sure that you're hydrated and try to sleep the night before if you can. Keep track of the hard questions that you are getting during the exam, and everyone's going to pass. You're going to do great. Just remember, like 88% of people pass on their first time, and you were probably in those numbers. So trust your training, and you're going to do just great. Thanks.